My name's Daniel Bax, and I'm a dermatologist here at Roswell Park Comprehensive Cancer Center. I went to medical school here in Buffalo at what now is called Jacobs School of Medicine. I went on to do my training at the University of Rochester. I did a year in medicine there, and then I did my dermatology training at the University of Vermont Medical Center in Burlington, Vermont, and I stayed on there as a fellow in Mohs micrographic surgery. I don't want to say it's tough because I guess I had some ideas, but if I'm looking for one, it would probably be my father, who's also a physician, though he's in a very different field than I am. I think, I can remember him reading physical plain X-ray films at, the living room table, and just going out to the grocery store or to siblings' sports games. People would come up to him, say hi, say, thank you so much. My mother's doing great. She's up and walking and doing so well. And I think just seeing that, being around that, it was hard to not want to have, that role in my community. Dermatology is a unique field in that if you don't seek it out, you won't be exposed to it in medical school. And having my brother be in the field as I was rotating through, he suggested I actually come here. He's working in dermatology here at the time and still does, and suggested I come shadow him and some of his colleagues. And it was very obvious to me early on when I did that that's what I wanted to do. It just seemed like such a great job. They enjoyed what they did so much. They were having fun. They were helping people. The job that Roswell does, successfully recruiting very competent and well-trained physicians, people who, are at the top of their field at what they do, to deliver very high level technically of care to patients that really are experts in the type of cancer that the patient has. That combined with also trying to make patients feel like people and not just a 10-15 appointment or, patient in room 4, but make a patient feel like a person, kind of threading that line, I think is what Roswell is trying to achieve. Mohs surgery is very unique in that it's a field where you do spend a fair amount of time with your patients. You're performing a procedure, but the patient isn't asleep, and you're also not a dentist working in someone's mouth. So in that way, you get to spend a fairly long time with a patient, and you can speak with them, and you can speak with their, son or daughter who brought them. And so it's a very fun field in that you really get to know the patient you're treating and spend an extended amount of time with them. I find that very fun. I also find the team approach that it takes medical assistants, nurses, a histotechnician, a whole lab staff that's behind the scenes. That's a very fun dynamic to come in and have a whole team who's excited about the day, who's, taking things seriously, but also having fun, joking around, sharing stories about their kids or what they did over the holiday weekend. And it makes work fun. And I look forward to that as well.